Within medical documentation, we know that there should be abbreviations, but I also want to give caution to overusing them. So it's recommended from the work group that anytime that you use abbreviation, that the staff knows about it. And so what I recommend is that you come up with a group of abbreviations that you and your staff that you work with will use. Because if you look at this example of a meme here, and I know it's supposed to be funny, but reading through it, it's going to probably take some of you guys some time to realize what some of the abbreviations mean. And that's not a knock at you or your knowledge and your education. It's simply that these are not necessarily things that athletic trainers utilize all the time. Or you may have certain ones that you always will use, and more or less your clinic has determined that these are going to be appropriate. And so as you're going through, make sure that, like I said, you have that master list and that everyone knows these. When you have abbreviations, though, you always must use them. So for example, right here in the middle of the page, we have HX for history. So if you determine that HX is something you're going to utilize as a medical abbreviation, this has to be utilized for your whole entire clinic for any time you document. So having a staff meeting, if you have a larger group, or if you're the head athletic trainer somewhere, maybe putting that information down as the director that, hey, this is what we are going to do. Another aspect I always get asked a lot is on routine care. So what do I do? So let's put this scenario into life right now. Let's say you're an athletic trainer at a secondary school and the cross-country team wants to come foam roll, and you have a large amount of foam rolls in your athletic training facility. We know that the team will just come in, foam roll, and leave. You didn't really communicate with them. They just did their own thing. So what do we do in that case? So anytime that we have things such as stretching or taping, foam rolling, and wound care, these are all some of the really common questions. So let's tackle the foam rolling one that we talked about. So if the patient comes in and you do not interact with them, those do not need to be documented. Now let's say that your patient, let's use the taping example. So your football coach at the institution you work for requires that every person must be taped, and they have provided you the tape, and that's something that you're completing. This does not necessarily need to be documented in each patient's medical record for every single time. What I do recommend, though, is because patient care is given, to make a generic list. And these are possible within some electronic medical records where you can go in and you can simply just put a list of everyone who received that care for an injury that, or for something that's not injured, and more as like a way to prevent injury. If we get into stretching, that's something a little bit different between stretching and wound care. So especially anytime that you're hands-on with the patient, anytime you're providing care, that's where it gets a little bit grayer. So my advice, based on the literature and best practice, is anytime that there's wound care, that should be documented. We don't know what could happen down the road. There could be infection, there could have been something worse, the patient could have an allergic reaction to the topical ointment used. So anytime you have something type of wound care, that should be documented. With stretching, again, that's that gray area with taping, that if it's just routine and for someone who's not injured, it can go into a little bit more of a general list. But if this is something that's occurring often and something that the patients are injured for, then we do need to be documenting the care. Another question is, when should you document? And so my best answer to you is it should be completed immediately following the patient encounter or during it if you can. That's in the ideal perfect world, and I know that we all want to live there, but not necessarily can't. What I do say is it should be completed within 24 hours. If I were to give you a list of things today and told you to remember them tomorrow, how much of it would you actually remember? Even going as far as this EBP talk, if I'm talking to you today about it, and you're going to have to take the quiz at the end to get EBP credit, you're probably going to remember more today than if I had you take the quiz tomorrow or a week down the road and see what you remembered. So if we can get that documentation done within 24 hours, that's ideal. Another thing we want to think about is that this should be completed within a private space. So if you're an office with a closed door, or somewhere where there's not papers out on your desk or patients able to see your computer, because of the HIPAA and FERPA governances that we already talked about. So let's say that you're the sole athletic trainer at a secondary school and you're seeing a large amount of patients, and you're telling me, Beth, this is not possible. I can't keep up with half of the documentation you talked about, let alone doing it within 24 hours. Consider dictation, and this is something that I did not use immediately when I was certified, but it's an easy way, and we know that physicians have done it, to go back and remember some of those key details of range of motion or manual muscle testing that we may have a harder time remembering down the road if we do not remember right away. And there's a lot of different softwares that are able to keep dictation and to keep it HIPAA and FERPA compliant. So this is something that if you can't get to medical documentation immediately, so you don't have any memory lag, that I recommend dictation.